Yeah. Donnie, would you call the roll, please?
Representatives Clifford. Connolly. Flitner. Hallinan.
Here.
Ottman. Here. Martinez. I know he's here. Stivar.
Present.
Wharf.
Here.
Madam Chairwoman.
Here.
9 present, Madam Chairwoman.
Good morning, everybody. We've got our Pandemic Response Review Task Force Bill, Senate File 30, up to date, to be presented to us by the good Senator Driscoll. You're chairman of Corps now, right? Yes, so that should be interesting, fitting in the pandemic task force along with a little redistricting this summer.
I'm not sure I'm going to be on it.
Well, we'll see. Anyway, I've got a few remarks about the bill later, but we'll let the senator present first, and then you can either stick around with us as we talk, or if you've got other things to do, that's fine too. So go right ahead.
Madam Chairman, committee members, thank you for the opportunity to present to you today. In front of you, I bring Senate File 30, Pandemic Response Review Task Force. This bill came out of the interim committee as a joint bill of corporations, which I inherited, by the way. I hadn't seen the bill, came on to corporations and was a little squishy on it. And as I worked through the bill and got it, I think this is absolutely a critical bill. And that's the takeaway of this is, I'll get into the bill a little later, and I'm going to do a little bit of explaining first. I don't have to explain to any of you what happened in your hometowns in the state of Wyoming. You know, we had a pandemic that we all second guessed what happened on, whether you wore masks, didn't wear masks, you want vaccine, don't want vaccine. State health officers, I mean, it goes through the gamut right down to your local cafes, the restaurants and the businesses, which businesses got to stay open, which ones didn't. We all had opinions on it. We all second guessed it. Thank the Lord we got out of this the way we did. Wyoming came out of it pretty well, but it could have been much worse. And we all saw things that we thought should have been changed. And, you know, some of the argument on our side was whether now is the time, the pandemic's not totally over. And for my end, I think now is absolutely the time while it's fresh in our minds. If you think we don't need to do anything, go down Main Street and ask any business, ask anybody that was affected by this, would they have done something different, or would they like to at least understand why it happened and should it happen again? And the truth is, we could be back in another pandemic in another 8 to 12 months. The same health orders are still in place, the same procedure for the governor and the health officer. And by the way, I make no comments as to up or down on this. I'm not trying to say that anything was handled correctly or incorrectly or anything was wrong, only that if we don't take a backward look at what happened and what we can do better, you can be assured that we're going to do the same thing again, and we're going to go through the same process. And it's a painful one. Billions of dollars lost, people lost their businesses, and a lot of personal liberties got restricted a lot. And our health orders they're tough. They come from an old time, and it's much different. They didn't have the communications we do now and some of the things. So I think it's really time to review some of these health orders that go back, some of them prior to the 30s and some of them clear back to when we had the last major epidemic. So I'll walk you through the bill and talk about it, but I think the need to look at doing a review is very clear to everybody if you really sit and think about it. Do you want to do nothing? Because that's really what we're coming out of this legislature with. We had a whole slew of bills. There's not really any bills there that have been really thought out that probably are going to last a long time. So this is our way to deal with it. So if you go to page 1, we're going to form a pandemic response review task force. And this lays out the duties of it, requires a report and a termination date. And I would guess there's going to be some legislation come from it. It probably won't be corporations committee likely, but could be judiciary. Page 1 representative of the Department of Health that the governor puts in. And this is an engrossed bill, so there's a few changes in it, and I'm not going to go through the amendments on it. 1 representative from K-12 educational community. 1 representative state business community. 2 members county commissioners. Those are all appointed by the governor. One from each of our tribes in the state of Wyoming appointed by the governor. Of course, we all know they were hit particularly hard. That's I'm glad to see that we've got one from each. 2 healthcare practitioners from the governor that are actually practicing practitioners working with people. 3 members of the House on page 2, 3 members of the Senate on page 3. And then we start getting into the meat of what this bill actually does. That's the task force layout. Task force will study the state's response to COVID-19 pandemic, and state's ability to respond to pandemics and other disease outbreaks. So this isn't just this one. It's looking not only backwards, but looking forward. What can we do to put some things in place to make it better? It includes an evaluation of Wyoming statutes governing public health orders since statehood. So it's going back to the original ones, looking through them progressively, seeing what they've done and what changes might be made. Authority granted in Wyoming Statute 35-1-240, the Department of Health to issue public health orders. That was a particularly contentious issue as, we found out in certain cases, our state health officer probably has powers higher than the governor of Wyoming, should that be there. And they'll look at this and say, is that appropriate? How does it look? Move back down, line 17, distribution of statutory authority provided Department of Health and local health officer to do the disease outbreaks. Take a hard look. Should it be controlled locally? Should they have some local control in how these orders are done and carried out? Line 21, the effectiveness of public health orders issued during the pandemic to mitigate the spread of the disease. And that's what we all know about. Was it appropriate? What happened? And could we have done it different? On to page 4, consistency or inconsistency of local health officer efforts during COVID-19 pandemic to mitigate the spread. We all saw that. Every county and a lot of cities had different enforcement methods and ways. Some had none, some had a lot. Line 6, state and local law enforcement authorities' responsibilities to enforce public health orders. Once again, I can tell you a lot of counties, they didn't do any enforcement. And they just ignored it. Some did a little tougher. Line 10, impact public health orders issued during the pandemic on businesses, communities, and the state's economy. That's a big one. Line 14, the response of K-12 schools and institutions of higher education to COVID-19 pandemic and the impact of public health orders issued during the COVID-19 on Wyoming K-12s and institutions of higher education. Once again, we all saw that back and forth. Representative Conley, I know, knew about it. We brought students in, we took students out, we had troubles. What are those procedures and how can we help the university, not necessarily by statute, but how do we help provide guidance to do it better? Same for K-12. Line 20, the goal of the task force to develop legislative recommendations to improve state's response to future pandemics and other disease outbreaks. The task force reported its findings, recommendations, Joint Labor, Health, Social Services Interim Committee, Joint Corporations Interim Committee, and the governor before July 1, 2022. Legislative members task force to receive compensation. It's our standard compensation that you get as a deal. And section 2, and same for the governor's appointments. Section 2 is the appropriation at the bottom of page 5. That's $10,000 out of the governor's office. And on page 6, it's $50,000 for the legislative side of it. And that concludes the bill. It's a $60,000 appropriation. We are in tough times. I represent to you $60,000 is a cheap investment to figure out. That's one tiny mistake. So without a doubt, should we enact this? Are we going to solve problems for next pandemic or wreck? Absolutely not. Can we lessen the impacts and make things better for you, me, and all our constituents? The answer is absolutely yes. With that, I'd stand for questions.
Great. Questions for Senator Driscoll. Representative Worf.
Yes, Madam Chair. I just had a question on page 2, on line 12. When you presented the bill, Senator Driscoll, you said that there's one member from both of the tribes. It says one for both of them. And I just wondered, we're fortunate to have a member on our committee. And I just wondered if that does need to be amended to where it says two, one from each tribe.
Madam Chairman,
Senator.
I think it should be one from each. We all know the history of the tribes. My belief is that should probably be amended to two. I also, overstepping a little on your question, I question whether one business person is enough on this. So I did misspoke when I did it. That was, and I think I presented it the other side as.
Senator Driscoll, to follow up on that. So, and I had some conversation with some last night. So right now there's 1, 2, 3, 4, 5, 6, 7, 8 listed. If we only go ahead with the one tribal member, but that's 8 and 6 from the legislature. Was there any feeling on the Senate side as far as the parity between the, I mean, I personally could think of a lot more non-legislative members to put on, but I was trying to, what was the discussion about that?
Madam Chairman, committee, we had some kickback on the size the way it was. You know, a good number of the members of the Senate felt like that there ought to be at least half legislators, that these tend to get out of control. That's a policy issue that we make. I personally don't have a problem with that. I've been on a number of the governor's task forces that were vastly outnumbered. I was one or two. I think they work if they're chaired well. What you really need is really good, smart people that honestly want to get something done. So I'm open either way, and I think the Senate will be in the end as
Okay.
well. Thank you.
More questions for Senator Driscoll? Representative Connolly.
Thank you, Madam Chairman. And Senator Driscoll, I think this is a great bill in general. I just do. We absolutely need to do it. Oh, my goodness. Sorry about that. But my question is, I want to make sure that we're not redundant with anything else that's going on in the state. If the executive branch is planning its own task force, something along those lines, this absolutely needs to be done. But I just want to make sure that we're not asking of people to doing the same thing.
Senator.
Madam Chairman, Representative Conley, I'm going to make a little admission on this. The governor had wanted, they're going to do their own review already. That's an internal review, and that's fine. I actually kind of blocked a member of the governor's office from being on this one because they're so close to it. I said, you'll be there to do testimony, but I'm not sure you need a person on the task force. That's a call you folks can make, but I can tell you when we did the Zoom call that was in the middle, they had staff came and that wanted to be on it. They did say they were doing their own review. And I made a recommendation as chairman of the committee to not put one on there. I said, you're welcome to come to all the meetings, but you're so close to it that it really makes it hard to get a great decision when you're spending time defending what you did. And it's hard not to. I'm going to tell you, for me, if I was me personally, it's hard not to take these type criticisms without taking them personally. And they really shouldn't be. It's truly done for the right reasons.
And Representative Connolly, my thought, I had a thought on that last night too, which is that because it does say that the goal is to provide legislative recommendations, and not everything and not every response in the state has to do with the legislature. I mean, the hospital association, the nursing home people, I mean, there are all sorts of, and so if I am so fortunate as to be on the task force, what I would suggest to people who come to the meetings to attend is that we, in essence, have sort of an overlapping circle time, that the people say, let's just say certain day is mainly focused on the businesses or the ag community or whatever, and that people who have come to testify us may then be able to, separately have their own, to be more efficient. If people are going to come together and talk to us, they may as well talk to themselves as well and take advantage at least of the drawing together, assuming we're not back on Zoom again, in which case they can do whatever they want. More questions for Senator Driscoll? Representative Clifford.
Thank you, Madam Chairman, and thank you, Chairman Driscoll. And I just want to provide the committee my thoughts. So, and thank you, Representative Worth. I really respect the fact of acknowledging the 2 indigenous tribes. I'm the one that did make the amendment to add, and I only added 1. And here's my reasoning why. When the pandemic was coming, we have 2 healthcare facilities on the reservation. One is what's called 638. So we came out from under the federal government and we kind of manage it on our own. And for the other tribe, Eastern Shoshone, they still are mandated under the Indian Health Service. And so what happened, we were very fortunate that the 638 facility, which is operated and managed by the Northern Arapaho tribe, took the lead. And so I was on a lot of the calls when the pandemic was going and all of that. And so what I had saw and what I had heard is IHS from the Eastern Shoshone was taking the lead of the Arapaho. And I knew it was going to be a concern with many, too many members on a task force. And I've personally had experience too. So that's why I only asked for one, because I saw that and they kind of took the lead there on the reservation. But I want to acknowledge, the fact that you would want to, but I knew there was going to be some pushback as far as the number on the task force. And I'll do my part to make sure that the Shoshones are brought before the meeting, that whoever that is, they're representing both tribes and they can be listened to and heard. So thank you.
Thank you, Representative Clifford. Representative Worf?
Yes, Madam Chair, I had an additional question. When the good bringer of the bill mentioned how different all the communities were, I wonder how important is, I don't see anywhere in here where we give direction that we want to have people from all around. One of the things I worry about is if we're too centrally located, if we pull too many people from the same communities, do you think we need to put anything in there to give direction that we want a good representation across the state, so that, we're only putting, 1 or 2 people from all these different categories. I can see how if it's not evenly spread out across the state, you may miss some of the things that were done in some communities just by not having that. So that's just a thought. I don't know if we need to say something. I would hope that as the governor put together this task force, that he would try to get, fair representation across the entire state. But, I look at that and I come from a part of the state where we kind of feel like we're always forgotten. A lot of people think we're in Utah, and we're close to Utah, but we're still part of the state. So that's one of the things that I guess Madam Chair, that I would ask is,
Senator
should we
Driscoll.
add that?
Any thoughts on that?
Madam Chairman, Representative Worf. It's pretty fun to watch our bodies work because that's a major oversight. And I think that's probably a critical amendment. The reason I say that is, as a legislator, I was one of the ones that spent time in Cheyenne and at home. And I will tell you, I run a campground and I had numbers of people came from Cheyenne north, and they were shocked that in Crook County where we were at, that no one was wearing masks and we were business as usual. And I would come down here and it was the next level. And I did make one trip to Jackson and stepped out of my vehicle without a mask on the street with nobody within 100 feet of me, and had a lady across the street holler that she was going to call the police if I didn't get my mask on. So it was very different in different areas of the state, the way it was done. Once again, I make no picks whether one was right or the other one was right. But if you put all people from down here on the task force, you'll have a very different view than you will looking at some of the rural and north areas of the state. So I think that's probably a welcome addition.
So you can, Representative Worf, you can kind of ponder what page, what line, how that would, I think you are right. I think the governor would be cognizant of that, but it certainly doesn't hurt to acknowledge size of community and location of community. Okay, I do have a mic. What time is it? 8. Oh, we're not too bad. Oh, look, there you am.
Madam Chair,
Who's talking?
hi, it's Donna.
Oh, hi, Donna.
Sorry, I'm like the Wizard of Oz back here. I have Rennie McKay from the governor's office.
We have him too.
Good, who's available for questions? Shall I admit him?
We'll just let him walk right up to the,
Okay, sounds good.
come on up, Mr. McKay. I like to see a resourceful person. Bodes well.
Good morning.
Good morning.
Madam Chairman. Rennie McKay, I'm Governor Mark Gordon's Policy Director, and I'm glad to be here with you. I'll offer some remarks this morning on behalf of the executive branch. And now that Zoom is working again, Stefan Johansson from the Department of Health, he's the Deputy Director there, is available if you have any questions for the Department of Health as you think through the response and also the processes that we had in place. So just wanted to let you know, as you mentioned, there will be executive after action reviews as well. Of course, this is the very normal procedure for the Department of Health. Even after smaller scale events, they will do an after action review or what they call a hot wash. And so that brings in the public health professionals to look at what's done. As you may know, Wyoming had and continues to have an existing pandemic response plan. And so that was continually updated over the last few years. For instance, even when a pandemic doesn't hit Wyoming, but moves around the world, they take into consideration what was learned both in the United States and elsewhere and put that into the pandemic plan. So the last time that was done was with the H1N1 virus. And the governor's office obviously will be doing a broader look at this as well, because there are so many factors to this, as you heard the sponsor discuss. There's the public health side of it. There's the economic side of it. There's supply chain issues, as we found with this pandemic, that there was huge challenges there in terms of supply. So, if we go back to March of last year, there's a travel ban in place nationally. There's a run on PPE. There's demand for ventilators. I didn't know what a ventilator was in detail at that point. And then all of a sudden we're learning so much and understanding so much more about our capacity. So we do definitely want to just say that we support this bill. I think that this is a really important action to take. And so appreciate that you're looking at this bill. I know that there were a lot of other discussions, and we think that the other policies that were brought up in bills this session should be considered as you go forward with this task force if it does move into effect. We definitely would participate at whatever level you see fit as legislators. As the sponsor said, we're maybe kind of sensitive, but definitely willing to take criticisms and talk about why decisions were made. But I think why I advocated on the Senate side for a role on the task force is I think that there should be consideration at least of processes. And so that the insider viewpoint of how the law is the sponsor of this bill mentioned is fairly antiquated. But so how was that applied? And I think you'll hear from county commissioners as well this morning. They had to look at that exact same thing. How does that law meet the road? And I think that a really significant piece of the conversation that should be discussed a lot is the enforcement of the health orders. So while an order is issued, what happens in Crook County or what happens in Uintah County when an order is either issued at the state level or elsewhere. So there's certainly a lot of local control in our current law when it relates to how you enforce a health order. But I think, I think the intelligence and wisdom of this bill is taking a review of this, the statutes, looking ahead at what a different pandemic could look like and how our laws might match up with different types of responses that you might want. You can look back and we can offer criticisms all day long about how this one was handled. But as you look ahead, what would happen if the nature of the virus was different? Or what do we want to do about more localized situations and how these statutes apply to different types of public health emergencies? And so making a change, does that change the effectiveness of the state or the county in its ability to respond to something else? The state health officer routinely uses her authority in other instances. So this law, this is not the first time this law has been used. While it is very old, the authority grounded in this law is used all the time. That's often with quarantining individuals or buildings with smaller scale events. A really serious example of that is with tuberculosis patients. So that's used now. I think that's something that we want to make sure is considered as any changes to law might move forward about how you handle those more isolated ones. There's an Ebola outbreak in Africa right now. So the state health officer's role in how you manage somebody who has a risk of exposure to Ebola. And as I understand it, the last outbreak, we had people from Wyoming who went to help with Ebola in Africa, including the state health officer. So how do we want to make sure, how do we want our laws to apply to situations like that? It's not likely to be widespread in Wyoming, but it is something that could be very significant for a smaller group of people. And so those isolation orders are very helpful right now. And as we respond and plan and think through what happens if somebody comes back from the Congo right now to Wyoming. I think I heard the line, there's 60 people a day coming back to the US from that part of Africa. So I think it behooves us to always consider the big picture if we're only going to have a once a century event, but also the things that happen every couple of years and how the statutes apply to those. So appreciate that this task force, I think, would be trying to consider all of that. And I guess I'd just reiterate those 2 points that we'll participate from the governor's office at whatever level you see fit to help out there, because I think the application and how health orders came to be, how they were managed, and the process for getting those in place is something that we think is pretty important to consider. And then also what happens at that local level with law enforcement. So stand for any questions that you may have. And again, my colleague, Stefan Johansson, the Deputy Director over at Department of Health, is available if you have questions for Department of Health.
Okay, questions for Mr. McKay? Representative Connolly.
Thank you, Madam Chair, and thank you, Rennie, for coming here. I was really concerned that there would be either redundancy or lack of support of the governor's office. And I really don't want this to be about turf at all, honestly, as a state. So I am curious of a couple things. First, I'm curious, you said it twice now, but maybe a third time, that the governor's office is absolutely interested in participation in this task force through, honestly, all of the appointments that are made. And then the second is, what is it that the governor's task force will do that's different? And will the governor's task force have legislators on it?
Mr. McKay.
Madam Chairman, I guess I'm not saying that there's going to be a governor's task force, so I don't think we're going to have competing task forces necessarily, but we will do an after action review. So the governor's approach generally is to be a little bit more fluid on that and not so much of a set task force. Those aren't his favorite things. He prefers to get smart people together in a room for a more discrete job and just have a discussion to try to have an outcome on that. So I would say that we'll have an after action review and some thoughts and some input that would be considered. And obviously, I think at some point, if there's a conversation that legislators should lend themselves to on that. I think, for instance, when we talk about how the CARES Act, the first 1.25 billion that came to the state was spent, that's a conversation we have to have with legislators, because all of you had a huge role in how that was spent.
Follow up.
Mr. McKay, what was the executive branch's ask in terms of being on the task force that the Senate didn't accept? Was it one member from the governor's office, something like that?
Mr. McKay.
Madam Chairman. Yes, I asked Senator Driscoll if I could serve, and he threw me out.
He's gone.
No, we just, the ask was, we thought that it might be important to have a person from the governor's office on there. So.
Okay, more questions, Representative Stivar.
Thank you, Madam Chairman. The question I have is the governor's after action review. Is he going to go to and bring county members in from all over the state to discuss the after actions? Or is it just going to be the executive branch part of the after action?
Mr. McKay.
Madam Chairman, it would be very wide reaching, because the issue that we really do feel like we faced was it isn't about just what the governor or the state health officer did or said. It was about how that had an impact in a local community somewhere across the state. So our relationship and our conversations with the county commissioners, with municipalities, has been strong throughout. We talk to the county commissioners once a week from the governor's office. So we've been very closely tied in with what's going on in those local communities and taken a lot of feedback throughout. And that's how we'd handle an after action review as well.
Follow up.
Thank you, Madam Chairman. Well, there's an individual that I know that helped write the federal pandemic plan that the state adopted. And with my conversations with him, the state didn't follow the plan that was adopted, that he helped write twice, when he was with NORAD and when he was with
So Representative Stivar, if you could tie that question
So,
into the
but
bill.
that's what I'm saying.
specifically.
They're the people, that's what I want to know is, are they going to bring people like him in? Or is it just going to be the executive branch? All right, that's the question, is there's citizens out here that are just normal citizens that are in no particular job. Are we going to go, county by county and have meetings in your after actions review, the executive branch's after actions report, and talk to each county and have meetings so the citizens can put their frustrations out, ask questions, so
So
we can get this done better?
Yeah, Representative Stivar, to tie that to the bill, I guess, is your question what the governor's office will do so that if you perceive gaps, you can amend them into this bill? Just, we need to make sure.
We're talking about two different things.
But, well, the point is though, that we're not, in this bill, we're not directing the governor's office, we're directing the legislative task force. So just,
The governor's office wants to be part of it.
right, but we don't need to bring in everything they do. Mr. McKay, if you have a response in some way.
Madam Chair, I guess two things. One is we'll participate in this task force that's contemplated in this bill in whatever form you see fit. If all you're asking us to do is come testify and take questions, well, that's fine as well. If you'd like someone from the executive branch to serve, we'll do that as well. I don't see a huge difference in likely how it all shakes out. So the wisdom of the body, I think does lead itself to success. I think Representative Stivar, to your question, so are we going to have town halls and that type of event to take feedback on how things went in the past? That may happen because there's two things that will come out of this from the executive branch. One is that the state's pandemic plan, so if you're referencing the state's pandemic plan that does exist, that will be updated as well after this process. And Mr. Johansson could discuss with you a little bit about that. That normally is not a fan or a popular event to go to discuss, but I think it will be this time around. So I think that there may be a lot more discussions around the state about how that plan gets updated. But then as we do an after action review as well from the governor's office, we'll be soliciting input from all over the state. And so is that going to be in the form of town halls, or is it going to be public comment period? We don't have all those details yet. But either way, I don't know if the timing of that is going to exactly align with the timing of your work, and the scope may change as well, because again, as I was saying, we've got to look at also how we administered the CARES Act. There's obviously, I think, criticisms and thoughts on how we could have done that better. We've definitely got some criticisms for the federal government about how they ran that program. So we'll be taking criticisms on that side as well. So there's a lot for us to discuss with the public as we move forward.
Okay, more questions for Mr. McKay? I do have one, and if you want later, you can come up, and I didn't email you a copy of my potential amendments because it was kind of late. I am thinking of on page 3, line 18, where we talk about the distribution of statutory authority to the Department of Health and local health officers. It occurred to me that there was a lot of involvement of Homeland Security and the local emergency management coordinators in distribution of PPE and various other things. So I was thinking of working them into that sentence, just so that we could understand the overlap of those functions and agencies. Do you have any thoughts on that?
Madam Chair, I think that's a very, I think that's a good amendment that I would definitely add in, because the Office of Homeland Security was very tied in with the Department of Health. We had what was called a Joint Operations Center, where the two of the Homeland Security and the Department of Health were the co-leads on running that response. And so it was very tied together in terms of the distribution of PPE, which a year ago, for the first few weeks there, that seemed like the crisis that maybe we were going to face that was going to be the most significant in terms of our ability to handle anything was the supply of PPE, which was so limited nationally, globally, and by county.
Good. Just wanted to check on that. Okay. More questions for Mr. McKay? All right, great. Thanks. And Mr. McKay, so if you want to approach the bar and take this little paper, that would be okay. Just so you have it. Sorry, I didn't get around to email it to you. That's, just optional, of course. Okay. Donna, who we got online? I have a kind of a list, but I think most of them are insurance bill folks.
Hi, Madam Chair, I have Jim Willocks and Cheryl Foland with their hands up. Would you like me to admit both?
Sure. Jim Willocks, welcome. Let us introduce yourself for the committee and tell us what you've got to say.
Good morning, Madam Chairman. Thank you. Jim Willocks, President of the Wyoming County Commissioners Association, here in support of the task force bill. As you've heard from the sponsor and from the governor's office, this generated a lot of discussion and a lot of emotion, if you will, on the correct way to respond to this. And the Commissioners Association really believes that a holistic approach to the pandemic review is the right way to do it. We support the makeup and our option to some of the amendments that we've heard. But I think what is important to realize is commissioners, outside the healthcare workers who are really on the front line, commissioners were on the front line of the response in a different way. As we stood up incident command centers, we held public meetings, we took criticism for doing too much, we took criticism for doing too little, and we also considered variances. Local variances were an issue that came through the commissioners and their department, our local Department of Health, all while continuing the work of counties that needs to be done on a daily basis. I do think it is important to note that from the beginning, commissioners have been in constant contact with the governor's office, Department of Health, and Homeland Security. Rennie mentioned weekly now, but when it started, we had daily conversations, and that flow of information went both directions. The idea of variances actually came from commissioners that said we would like some local variance ability, and that idea was adopted. And so we have a lot of good ideas, but we also have a lot of things that we know we want to change. And we really believe this holistic approach is the best way to do it. There are several bills out there that take piecemeal approach, and the commissioners are monitoring those. But we really believe this is the way to get an answer that addresses not only the large scale pandemic, but doesn't accidentally interfere with those. I hate to call them minor incidences, but those semi-regular incidents that the Department of Health has to deal with on a regular basis. And so we look forward to participating. I believe we will have some input to the governor's hot wash, if you will, but the truth is that is a component of the task force, not the only piece of it. And so we look forward to participating at any level. We urge this committee to move it forward because we believe that that together we can come up with ideas that will both verify what we did and improve upon what we did. And I think with hindsight, we will see that we did a little bit of both. And that's why we support this. And so, Madam Chair, with that, I would stand for any questions and urge your support. I want your amendment on Homeland Security is very valid. Homeland Security was an integral part of our incident command team and the distribution. So adding that in, as you mentioned, I think is a good amendment that brings those two together. So any questions, Madam Chair?
Questions for Mr. Wilks? Mr. Wilks, could you just really briefly give us an example for those of us that are not involved in such things of what you didn't mean? I know we're calling minor, not minor, obviously, to those involved, but just so we can get a sense, I don't know if you could hear my caution that we not do a Maginot line and design something to respond to only the one thing on our mind. What can you give me an example of something in the last couple of years that has been of another type?
In Commerce County specifically, I didn't, but I've learned about the tuberculosis issue that was just brought up. Those diseases that are around our country that we are dealing with semi-regularly. H1N1, as it was noted, which looked like it would be major and then became less of an issue. That's what I was referring to, and I think Rennie alluded to it as well. That I hate to call them minor, but they are more regular occurrences that aren't really statewide, but the public health officers and local health officers have to deal with it. So that's what I meant, but I don't know if I could honestly give you a specific in Commerce County. There's probably others around the state, and if you need that information, we could find it, but that's what I was alluding to.
Just wanted to make sure we had an idea. Representative Romero Martinez, did I see you getting ready to speak? Go ahead.
My question is, does this plan also include, in terms of other types of events, chemical and biological threats?
Mr. Wilks.
That's a little bit above my pay grade because I'm not sure if those fall under the health issues, because those are more of a Homeland Security issue, and I would defer to maybe I see Stefan's on for maybe later, so I'm sorry, I just don't have that answer, Representative.
The bill specifically goes to pandemic. I understand the question because clearly, a bad actor poisoning the water supply or something would also be an issue. But I think probably that's a little beyond the scope of this bill. And if we did that, we would need a lot more than a year and a half. Did I see a question down there? Nope. Okay, great. Thank you very much, Commissioner.
Thank you, Madam Chair.
Hang around in case we think of something else. Ms. Noland, I see your Foland. I'm sorry. Are you on for the pandemic bill? You're not early for the health insurance bill?
I'm here for both, Madam Chair.
Okie doke. Boy, go ahead and introduce yourself for the committee, please.
Thank you, Madam Chair, members of the
Could you-
committee.
The sound is kind of quiet. Maybe get a little closer to your mic.
I'll try that. How's that?
That's better.
Thank you, Madam Chair, members of the committee. My name is Cheryl Foland. I am the legislative advocate for the Wyoming Association of Addictions Professionals, and I'm a private practice licensed clinical social worker in Rawlins. And I appear in favor of this bill with some insight on one role that was not really thought about until an afterthought, and that was the role of the mental health worker and substance abuse provider during the pandemic. Wyoming unfortunately saw massive increases in substance use, which led to domestic violence, which also led to an even stronger awareness that mental health providers tend to get overlooked when we have things occur. And Senator Driscoll had identified 2 healthcare representatives. I would also encourage that that the membership add a person who has an area of expertise with mental health and substance abuse. It's very significant, and our roles were increased not only with the general citizenry of Wyoming and what we saw increases of mental health issues in children not being in school, but also healthcare workers who were the front line. And we as a whole in the state were not prepared for that either. So again, just encouraging a representative from mental health and substance abuse be included in this task force. And with that, I stand for any questions.
Questions for Ms. Foland? Okay, Ms. Foland, I do have a question, and just to clarify, certainly mental health and substance abuse workers would be very welcome to testify and bring their concerns. Explain for me a little bit more the role of having an actual mental health worker be able to take time off to serve on the task force. Just the difference that you perceive of being on the task force versus testifying to the task force.
Madam Chair, members of the committee, one of the things that we have kind of looked at and evaluated is that because mental health is kind of an afterthought, but we are certainly one of the frontline people who have information and can also contribute from the task force, and also not just in testimony, but also being able to work as a member of the task force to help maneuver through the mental health situations and our roles incorporated into hospitals, into the outside work as well, sitting on the incident committees. So I think from our perspective, at least from substance abuse perspective, we bring a set of knowledge that doesn't necessarily exist from a healthcare, physical healthcare provider that would sit on the task force.
Okay, thank you. More questions for Representative Flitner?
Madam Chairman, and not necessarily a question, but just to note that on your 3rd suggested amendment on your list, Madam Chairman, you had suggested that on page 4, line 11, we insert after businesses healthcare providers, we could maybe insert language that would also include mental health care providers too, which would at least ensure that they are noted as being a priority in terms of what the task force would look at. I would make that suggestion.
Okay. More questions for Ms. Foland? Okay, thanks very much. We'll see you again shortly, I believe. Okay, Donna, who else is on? Is Mr. Johansson still on there? I really didn't call on him earlier, but
yes, I've admitted Mr. Johansson.
Okay. Good morning, Mr. Johansson. Sorry for not calling on you earlier. I wasn't sure if you had your hand up or you just were hoping to not hear an assignment for yourself.
Madam Chairman, members of the committee, good morning. Stephen Johansson with the Department of Health. I'm just really here at your disposal as a committee, happy to answer any questions. But Director McKay, I think, stated the executive branch feedback very well. As he mentioned, which I'll just reiterate, we do in any public health event or emergency, we do after action reviews as a department that involves any stakeholder that was really involved in the response itself. So obviously this is a much larger event than most of us have experienced in a lifetime in the Department of Health. But Madam Chairman, you may recall several years ago, we had a few nursing homes that were in deep trouble that the Department of Health and the state really had to take over because the company became insolvent and we had concerns of the life safety of the residents. That was a public health response, really an emergency response for lack of a better term, that did involve numerous stakeholders outside of the state executive branch, including legislators from those areas, county commissioners from those areas, and local stakeholders that were helping us in the response. And in the after action review, the hot wash, as we call it, that did involve many different people outside of the executive branch. Madam Chairman, as you might recall, I think the Labor Committee worked on several issues related to the nursing home closures and considered statutory changes that we testified on, that we had work groups on following that response. So just wanted to provide an example of obviously a much smaller event, but a very serious emergency that occurred where just based on our normal processes, we do those after action reviews or those hot wash committees, if you will. But as Director McKay mentioned, we welcome the opportunity to participate in a task force like this. I think the department and the executive branch's perspective is obviously crucial to the conversation, and we'll do our best to integrate whatever efforts are ongoing in the executive branch to look at what worked and what didn't work, to also inform any legislative committee or task force that's working on the issue. So wanted to offer that, Madam Chairman, and happy to stand for any questions if the committee has specifics for the department.
Okay. Questions for Mr. Johansson specific to the bill? Representative Connolly.
Madam Chairman, I think this is specific to the bill because I'd like to know what is the outcome of a hot wash? What's the product? Is there a document, something along those lines?
Mr. Johansson.
Madam Chairman, Representative Connolly, thank you for that question. It varies, but yes, there's typically a report. And the reason I say it varies is because there's kind of an emergency response process for an after action review or a hot wash when it, as Director McKay mentioned, when we have to work with Homeland Security or I should say, get to work with Homeland Security. For example, there's emergency preparedness processes that you look at afterwards to see what should have been improved, things like incident command structures, that kind of detail, and often a report from the folks that run the hot wash or the after action review. Depending on the scale of the event, and this would clearly be one of them, in my opinion. For example, in the nursing home closure issue that I just mentioned, there was a report that was issued to the Labor Committee. There was a report that we did ourselves with the stakeholders to basically look at both internally in terms of processes or policies that we have as a department, what should be changed, what could be changed, and then as that scales up, what might need to be changed legislatively, what might need to be changed with our relationship with local or county officials. So Representative Connolly, it really does vary, but I think given the magnitude of the COVID-19 pandemic, a full-scale report would be absolutely appropriate at whatever level, whether it's a legislative task force or something the executive branch is producing.
Thank you, Madam Chair. Mr. Johansson, has it started yet, or could you give us a timetable for the hot wash?
Mr. Johansson.
Madam Chairman, Representative Connolly, thank you. I would say it has not started officially because we're still in the midst of the pandemic. The public health emergency is still ongoing, and we anticipate at the federal level it will likely continue through the better part of this year. We have not assembled the large group that would be necessary to start doing this type of after action review. However, as Chairman Wilson was mentioning earlier and Director McKay mentioned, we did start at the early stages of this pandemic in a unified command with the Department of Homeland Security. And throughout the past 12 months, and especially in the middle part of the summer, we started that conversation with that agency specifically of what had worked to that point and what could be improved going forward, especially as it interacted with the relationship between our two agencies, things that needed to continue to be managed, things in the early stages of the pandemic, like the rollout and purchasing and distribution of PPE, that we started essentially doing the same kind of process that a hot wash would involve while we were kind of managing the pandemic. So to make it simple, Representative Connolly, it hasn't officially started because we're still in the midst of it, but we've had elements of it with various stakeholders that we've worked to try to make improvements during the past 12 months.
Okay, more questions for Mr. Johansson? No, very good. Thank you. Thanks very much. Donna, are there any more people online to testify on this bill?
Yes, Madam Chair, I have Dr. Stan Hartman.
Okay. Send him in. Remember, guys, we have another bill to do still. Dr. Hartman, are you there?
Yes, I am. I just had to unmute.
Oh, there you go.
myself.
Welcome. Introduce yourself, if you would, for the committee, please.
Yeah, Stan Hartman. I'm a physician. I'm the county health officer in Laramie County, and been a physician in Wyoming since 1986. I'm a board certified internist. I'm here to speak on behalf of the Cheyenne-Laramie County Health Department, myself, and also the Wyoming Public Health Association.
Dr. Hartman, could you get a little closer to your mic? It seems a little faint in here. I don't know if it's our end or yours, but.
Okay, is that a little bit better?
It is better, thank you.
Okay, I'll lean in. Do I need to repeat my introduction, or can I just pick up
We
from
heard that.
Okay, well, thank you. And I appreciate being able to do this virtually. It's a lot, as you can tell, I'm not dressed very formally because I'm in my home. It's a lot easier than trying to find a parking spot right now. So this actually works well for me, and I hope it works well for you. I want to talk in support of Senate File 30, the creation of the task force to evaluate the COVID-19 pandemic response. I think this is an extremely important thing for us to do in emergency management and public health. We are used to doing what's known as a hot wash, as you just heard Mr. Johansson talk about. And this is basically an after action review and can be a small undertaking or very large undertaking, depending on the size of the response that you're looking at. For something like the COVID-19 pandemic, I would expect that this would be a fairly ambitious, detailed undertaking. And I've read Senate File 30. I've looked at the different provisions in it, and I wholeheartedly agree that I think this is definitely the way to go. I note that the task force that this file would create consists not only of the executive branch of the government, but executive branches, public health, business, schools, the tribes, all the major stakeholders would have a chance to provide some input. And the goal of this task force would be to review the entire pandemic response from start to finish, look at what went well, what didn't go so well, what we did a good job at, what we need to do better at in the future. And the important thing to remember is that hopefully we will not see a pandemic like this again for another 100 years. The last one was the influenza pandemic of 1918. And we've had less disruptive pandemics since then, HIV, for example, and some others, but nothing like this. This has been unprecedented in the last 100 years, and hopefully we'll not see another one for another 100 years. But we have to remember that the next one may not look like this at all. It may be something totally different. We could be looking at a more contagious variant of something like Ebola or a viral hemorrhagic fever, or Lord forbid, someone would accidentally or deliberately release smallpox again into the world. And there are stores of that still present in both Russia and the United States, and there may be other countries that have it too. And there could be some other respiratory virus that crosses over from animals to people at some point in the either near future or distant future. So it's really important, I think, for us to look at what we did, how well we did it, what else we need to look at. And in particular, one of the important parts of this would be how well we all worked together and what the successes there were, what we need to do better. I know in Laramie County early on, our Department of Health director reached out to all kinds of different agencies and elected officials, including the commissioners, the city council, the law enforcement, fire, the schools, the hospital, et cetera. And she put together a pretty good team. That doesn't mean that we couldn't improve again in the future and do a better job even than we already did. But I certainly welcome the task force proposed by Senate File 30, whether it would have to wait until the declared state of emergency is over, or whether it could even begin working a little sooner and start gathering its data and getting testimony and reviewing literature and reports from the field, et cetera. That would be up to the task force, of course. But we would certainly welcome that from the public health standpoint. And I think it's a great idea. And there is some other legislation pending. And I guess I would urge the legislature as a whole to let the task force do its work and submit a detailed report so that we have better guidance as to where to go with other types of legislation. That's not to say that the task force won't recommend some of the same things that are in that legislation, but at least we'll have a better knowledge base and we will have had time to reflect and gather more information.
Okay, Dr. Hartman, I'm going to cut you off there just so we can take questions, and we've got another bill to consider yet, even after this one. So are there questions for Dr. Hartman?
And I was about to cut myself off anyway, so you're
no disrespect intent, just we've got, we always, it's all fascinating and worthy of discussion, certainly. Questions for Dr. Hartman? I don't see any, but thank you very much. I'm sure you will hear from us and we will hear from you again.
Well, thank you very much for your time, and I appreciate your being willing to listen to me.
Thanks very much. Don, is there anyone else on this bill?
Have a good morning.
Thank you.
No, Madam. No,
Okay.
Madam Chair, I don't see any other hands up.
All right. Any last folks in this room to speak on? Yes, ma'am. Come forward. You can come forward and, Dr. Fisher, introduce, sit up at a mic. So the mics are up here. And if the little black kind of foot that the mic sits on, if you press, you'll see there's like a little depression in the front, and that will turn you on.
I'm Dr. Carol Fisher, and I'm a resident of Western Wyoming for 60 years. I've been a physician in Laramie County for 35 years almost. And I'm in support of this bill. I think it was very confusing at the beginning of the pandemic to be a physician. Even now, I think we're just seeing the top of the iceberg, the anxiety, the depression, the other illnesses that weren't adequately addressed because of the pandemic are still there. And I think it's critical that we really look at any event that could happen in the future and be proactive about future episodes and try to get through this one.
Very good.
Thank you.
Questions for Dr. Fisher? No, thank you very much. And thank you for all the work that you've been doing. Okay. Hearing no, then we'll close public testimony. Do I hear a motion on the bill? Bill moved by Flitner, seconded by Worf. Okay. We do have, we can discuss broadly, but keeping in mind the time, we've got amendment pages from me and from Representative Connolly. Is there any other discussion before we look at those amendments? Representative Worf.
Madam Chair, I also scratched down some comments, some amendments that I would like to offer when the time's appropriate.
Okay, very good alert. Representative Hallinan.
Madam Chairman, I have two one-word amendments to page 2 and 3 that I'd like to introduce.
Okay, well, I
also.
guess we'll have to go through page by page then. Any other general comments? No, okay, so those of us who have written longer ones, maybe we could, well, no, I guess we'll just go page by page. I guess is there anything on page 1? Representative Worf?
Yes, Madam Chair, I would like to suggest on page 1, line 12, that we delete the semicolon and that we insert the following. It would say representatives who will represent the various communities throughout the state and the varying responses to the pandemic. And that gets at the question I raised earlier about trying to make sure that we get a good cross-section and we get people that saw different responses.
Right,
in
could
those
you
communities.
restate it again? I was writing. Representatives who will,
Representatives who will represent the various communities throughout the state and the varying responses to the pandemic. Say that louder.
yeah, we may have a grammar cleanup or something. Okay, I have representatives who will represent the various communities and responses from throughout the state. Is there a second? Seconded by Stivar. Any discussion or friendly amendments?
Yeah, and I'm open to, there's some
Represent-
wordsmithing going on,
Yeah,
so.
Representative Flitter.
Yes, ma'am. Madam Chairman, I would just say representatives from varying communities or various communities rather than repeating. Just to make it read a little less wordy.
Or perhaps even an amendment of the friendly amendment, representatives from a variety of communities.
Works.
That's the intent.
Okay, so having
Madam Chairman,
friendlyized the amendments, yes, Representative Hallinan.
Madam Chairman, I have my amendment on page 2,
Uh-huh.
I think will answer Representative Worf's concern.
Okay,
And that is
what is your thought?
on line 20, I would change from 3 to 4 members of the Wyoming House of Representatives. And on line 2 on page 3, I would change that to 4 members of the Wyoming Senate. And that would cover, I think, the representatives of the places around the state and their different responses to this bill or to this pandemic. And I'd also like to say at this time that there are 1, 2, 3, 4, 5, 6, 7, 8 representatives of the governor. The governor appoints 8 members to this commission and only 3 to from the Senate and the House. And I think that would make this into a governor's committee. And that could be a whitewash of the government, the executive branch, if the governor appoints all these folks to this committee. So I think that we need to balance this committee by putting 4 members of the legislature from each house.
Okay, let's hold off on that because that's not, I think that's perhaps
Yeah.
can be considered separately. So the amendment on the table is on line 12, after the word following, insert representatives from a variety of communities. Is that, okay.
Mhm.
And then the colon. Any further discussion on that amendment?
Question.
Question being called, all in favor, raise your hand. 1, 2, 3, 4, 5, 6. Okay, all right, that amendment passes. Hang on, I gotta tidy this up so the secretary can follow. Okay, okay, on page 2. Now let's try, this is going to be, let's see, I don't have any on page 2. So
Madam Chair.
let's try to do it kind of not all over the place, but Representative Worf.
Yes, Madam Chair. I also would propose an amendment on page 2, line 5. Strike 1 and put 2 representatives of the state's business communities. So we'd strike community and add communities. one being large and one being small.
The business community or the representative?
The representative. The businesses, we were kind of looking at maybe like a corporation sized business. I don't know how we would define that, but we were trying to get at the different impacts versus a big business versus the mom and pops, because I think they all had different impacts and responses.
Is there a second? Seconded by Ottman. Discussion? So I do have, I just want to caution us, and because I certainly, as I was going over this last night, I had a number of things like, well, it would be great to have a person from ag and various other things. Keep in mind that the larger we make the task force, the bigger we have to make the appropriation. We're gonna, I mean, we can probably sneak in one person or something with under the current appropriation, but you're gonna really have to consider if we add a bunch of people, we're gonna have to increase the appropriation. I mean, if we don't, Committee 2 will. Representative Stivar.
Yeah.
My amendment is,
Is that a friendly amendment to this amendment?
no, it's the next one down.
No, we haven't voted on this one yet, so.
Track.
Oh, I see what you're gonna do. Okay, but anyway, so let's, and I guess I would just say, I'm not sure, I mean, so right now it says 2 and business communities. Was the language about large and small as part of your amendment?
Madam Chair, that's, I don't know if we need to explain that, if we need to put that in there. I just know it was mentioned by the presenter that we
Right.
probably should have 2 different business
Right.
representatives.
I feel like
I'm going to
that-
leave it to
yeah.
the body to decide whether we add large and small or if we just leave it at 2.
The thing is that that seems a little hard to pin down in a few words because, you think you could have, let's just say the hospitality sector, you could have a 10 hotel chain or, some guy's taco stand that's big, I mean, it's kind of hard to pin down the size of the sector versus the size of the business. I'm not sure.
I wrestled with that too, and that's why I say it may be cleaner and easier just to say 2 businesses.
That my thought would be to leave it at the 2 now, see where we end up in terms of people at the end. And that no doubt there will be some more work on the floor. Okay, the
Madam
amendment.
Chairman,
Representative
I
Helm.
have, I think, a friendly amendment that concept in that amendment. And that would be to say that one of those businesses was shut down during the pandemic. One of those businesses have been shut down during the pandemic.
Is there a second? Well, first of all, is that a friendly amendment?
Yes.
I'm asking the person who brought the original amendment, not you. Representative Wharf.
Madam Chair, I do think it's a friendly amendment. I'm going to leave it to the body to decide if that's the direction they want to go. To me, it does narrow that down, and it changes a little bit from what my initial intent was, but that may be important to look at businesses that were closed versus businesses that were not. And I guess my assumption is that the person that had a business closed down would be representing all the businesses that were closed down, so people could contact them and at least have a vector so that they are. And so
Who was it that seconded this? Was it? Okay. So discussion on this amendment. So I just want you to remember, we are setting up the task force itself, not specifying who can testify to the committee. If a person is on the task force, they need to come to the task force meetings and help, develop legislation and plans and that sort of thing. That might be a little bit of a burden to put on somebody who's just reopening up their taco stand. I'm just my thought. But so for now, the amendment is that it will be on lines 5 and 6, 2 representatives of the state's business communities, maybe one representing businesses that were closed down. Representative Flitner.
Madam Chairman, thank you. And not to belabor this, I wasn't, I did agree with that initially, but I think we're just going to get this thing too broad. I think if we help to define the role of the task force, That will help to roll in those people who are affected. That will help to roll in large and small businesses. And I think between the county commissioners, the legislators, and the representatives that are already noted, we'll be able to get adequate response from everybody who is impacted just by defining the role of the task force. So I will not be supporting your amendment, Representative Worf.
Okay, so the amendment that we are presently voting on is that paragraph 3 would say 2 representatives of the state's business communities, one of which represents businesses that were closed down. Okay, all in favor of this amendment, raise your hand. 1, 2, 2. Opposed? 1, 2, 3, the rest of us. Okay, so that paragraph 3 continues to say 1 representative of the business community. And keeping in mind that, there's always second and third reading and such like. Okay, further amendment going down, is there any amendment on paragraph 4?
Madam Chair.
Representative Connolly.
Madam Chair, my amendment is on paragraph 2. I didn't go up quick enough.
Okay.
And so, Madam Chair, I'm going to make a couple of suggestions as we move down, but the purpose of them is to ensure that there's no issues regarding turf, in all honesty. And so my suggestion is on page 2, line 3, that the representative of the state's K through 12 educational community should be appointed by the superintendent of public instruction. We have a top 5 official who is responsible for education. So let that person make that
Is there a
appointment.
second? Second by Flitner. Any discussion? Okay, all in favor of this, of the line 3, delete governor and replace it with superintendent of public instruction? All in favor, raise your hand. 1, 2, 3, 4, 5, 6, everybody 9. Okay, very good. Bonnie, did you get that? I'm trying to speed up a little bit. The people who are out here for the insurance bill are seeing their lives drain away before their eyes. Okay, Representative Connolly.
Madam Chair, if I could, I want to move to 4.
Okay.
And the
4.
same kind of idea on line 9, because we have, I would like to add or municipalities. So we know that we have a county commissioners association. We also have an association that represents the municipalities. Municipalities, I don't want to add anyone or subtract. It's just a choice between the county commissioners or municipalities.
Okay, is there a second?
No turf.
Seconded by who is that, Clifford? Okay, any discussion? All in favor, raise your hand. 1, 2. All opposed, raise your hands. 1, 2, 3, 4, 2 to 4. That was, some people didn't vote. Okay, anything else to paragraph 4? No. That failed. Representative Stivar?
Line 8, take that members from 2 to 1.
Is there a second? Okay, any discussion? Oh, I will just say, from having compared the engrossed version to the original version, this was a change made by the Senate. So that presumably so they could have big counties and little counties, but that I happened to discuss with people in the hall on that. Any further discussion? Okay, all in favor, raise your hand. 1, 2, 3. All opposed? 1, 2, 3, 4. Okay, that amendment fails. Paragraph, anything else on paragraph 4? Paragraph 5. Paragraph 6.
Madam Chair.
Representative Hallinan.
1, 2, 3, 4, 5, 6. Yes, that's the amendment that I would like to have, and that would change from 3 to 4 members of the Wyoming House.
Paragraph 6 is about the healthcare practitioners.
It's what?
Paragraph 6.
Okay.
Yeah.
I don't have any problem with that.
Okay. Representative Stivar.
My amendment is take it down from 2 to 1.
Oh, is there a second?
I'll second.
Seconded by Worf. Any discussion?
Question.
Question, all in favor, please raise your hand. 1, 2. All opposed, raise your hands. Everybody else. Okay, now that fails. Any more amendment to paragraph 6? Okay, paragraph 7, the House of Representatives,
Thank you, Madam Chairman.
Representative Hallinan.
I would change on line 20, 3 members of the Wyoming House to 4 members of the Wyoming House of Representatives.
Is there a second? Second by
And the
Flitner.
reason for that, Madam Chairman, is the idea of the distribution around the state. That gives an ideal way to give a representative to different parts of the state. And the other part, I think, there are 2, 3, 4, 5, 6, 7 members that are appointed by the governor. I think that this will tend to cause this committee to be a governor-controlled committee. And I think we need to have the legislature have the dominant role in this committee. So for that reason, I would change that to 4 members.
Okay, you know, I had a complaint previously from Bonnie, are you following okay, the seconds and all? I remember when Donna was having to do it by internet, I wasn't that clear on the seconds and whatnot. I don't remember who it was. Sure. Okay, that's right, you pick them. Okay, Secretary's choice. Okay, any discussion on the amendment of line 20, changing 3 to 4? All in favor, raise your hand. 1, 2, 3, 4, 5, 6. Opposed? 1, 2. Representative Romero Martinez, you raised your hand twice. It's not allowed. You're not allowed to do that. Okay, 5 to 4. All right, that passes. Okay. Page 3. Representative Kennelly.
Madam Chairman, I'd like to add a member, and I didn't know exactly where to do it, so I'll just do it at the end. And so it would be, I guess, on page 3, line 5, to add 1 representative from the governor's office appointed by the governor.
Is there a second? Second by Clifford. Any discussion?
Yeah, Madam Chair, if I could just say, I really don't want this to be about turf. And the governor, and in all due respect to good Representative Hallinan, the governor is only appointing the person from the Department of Health from the executive branch. The other people that are being appointed are from the county commissioners. They're not representing the governor. From the business community, I imagine the Business Alliance, they're not representing the governor. Certainly a member from the tribe isn't representing the governor. The only person I think from the governor's office is going to be Stefan. And so I would suggest that we have 1 other person, because the governor's office has been the office that has been responsible for the response in so many different ways. So let's bring him in. Let's have him sit at the table.
Okay, any further discussion? Representative Stivar? No, okay. Any further discussion? All right, all in favor of the amendment on line 5 to add 1 representative from the governor's office appointed by the governor? All in favor, please raise your hand. 1, 2, 3, 4, 5. Opposed? 1, 2, 3, 4. Okay, any further amendments? I will point out that at present we have 4 representatives and 3 senators. I'm sure that'll go over well. Yes, Bonnie.
Madam Chairman, Representative Hallinan had previously in the conversation on page 3, line 2, to change the 3 members of the Senate to 4. Was that included in the page 2 amendment when we had the 4 members of the
Well,
House?
he discussed that about 10 minutes before we got to his
Yeah.
actual amendment, but he didn't actually present that
Okay, so-
when we moved the amendment. So that should be moved separately, Representative Hallinan, if that is also your intent.
Thank you, Madam Chairman. On page 3, line 2, I would change from 4 members of the Wyoming Senate, or to 4 members of the Wyoming Senate from 3. So it would be 4 versus 3.
Okay.
So with that, that would be both of my amendments.
Seconded by Stivar. Any discussion? keeping in mind that since we added the governor's office, now the governor's side is actually still one ahead of the legislative side, and the budget is growing. Okay, I can see that appropriations is gonna have something to work with here. All in favor of the amendment on line 2? I'll raise your hand. 1, 2, 3, 4, 5, 6. All opposed? 1, 2, 3. Okay, that passed. Okay, any amendments to page 3, paragraph B? I'm just trying to keep up with my own amendments. Representative Connolly.
Madam Chair, can I just make a comment or a question to you, because you've said it twice now about increasing the appropriation. The appropriation is only increased when we increase representatives or senators. There's no appropriation for other members, is my understanding.
There is the bottom page 5, $10,000 for non-legislative members. And 50,000 for legislative members.
Thank you.
So, yeah, we're yeah, there you go. Okay. Now we have the assignments of the task force, page 3. Anything in paragraph 1 or 2? I've got something for 3, but anything in paragraph 1 or 2? No. Okay. Committee, I handed out to you an amendment, guys, down at the end. Please pay attention. There's an amendment page from me, and I would like to move on page 3, line 18, after the, and I have it written out there, but so you can see the text, inserting Homeland Security and local emergency management offices. And the rest of that bit there is just sort of a language bit. Is there a second?
Second.
Seconded by Flitner. Any discussion? Okay, all in favor, please raise your hand. 1, 2, 3, 4, 7. No, wait, not, okay, not you. Okay, everybody. All right. All right, that amendment passed. Good. All right, any more amendment to the bottom of page 3? Top of page 4, Representative Ward.
I know you're running things, but I noticed that your first amendment on page 3, line 19, you have delete officers. And I didn't want you to miss that.
Oh, you know what? That's actually, that should be line 8. No, that's page 3, line 19. That's the end of that's the cleanup of the paragraph 3. Because what you're really saying is Department of Homeland Security, local health officers and local emergency management offices was inserted on line 18. So you don't need the word officers on line 19.
Okay,
That's all
I
that-
just
Yeah.
wanted to
no-
make sure we didn't skip
Nope,
that.
that's
so
all
sorry.
one cluster. Okay, page 4, paragraph 5. Paragraph 6. I do have an amendment, page 4, line 7. In my discussion with the governor's office, they had been in favor of inserting a law enforcement person specifically into the task force. And I get that. And of course, we've tweaked with that. I was a little worried about expanding it. And so I was just going to add in here, maybe it's not the most perfect grammar, but after responsibilities and capabilities, because what I think they were hoping to get is not only do they have legal responsibilities, but then the question of whether they are actually able in terms of personnel or just local politics to carry out what they were theoretically supposed to do, or if they wanted to even. Representative Ottman. Let me just
Yes,
ask, is there a
would this-
second for discussion? Seconded by Connolly. Okay, go ahead.
Would this be the place to, or would it be that we should discuss, since the sheriffs are who is in charge of the counties, would this be the place to discuss that? Because they really have an important part on what mandates come down, what is enforced, what isn't enforced, whether they're able to enforce it. So to include them, I think is very important. Is this the
So
place
the
that
thing
would
is,
be?
this is the assignment of the task force. Who is on the task force was back on page 2, and
Oh,
that's
okay,
not
okay.
this part here.
Thank you.
Okay, any more discussion on this amendment? It's kind of a smallish one. Okay, all in favor, raise your hand. 1, 2, 3, 4. Everybody, or no, not Stivar? Okay. Okay, 8-1. Okay, paragraph 7, page 4, line 11. You see, I just had a motion to insert after businesses, healthcare providers, the impact of the public health orders on the healthcare providers. My thought. Is there a second? Second by Flitner. Any discussion?
Madam Chairman, and this is,
Representative Flitner.
would you like to make a notation about mental health care providers as well? Or do you think healthcare providers will roll them in adequately?
I wonder, as a friendly amendment to your friendly amendment to my, whether we might actually want to say the impact of public health orders issued during the COVID-19 pandemic on businesses, healthcare providers, mental health and substance abuse needs, communities, and the state's economy? Is that, I mean, that's, boy, that's kind of a, I think Representative Connolly has one later as regarding the health. Let's do Representative Connolly.
Yeah, thank you. Thank you, Madam Chair. And honestly, I think Representative Flitner, to get to your suggestion as well as the testimony, that my first suggested amendment for a new Romanet 9 is a better place for it. And honestly, adding in mental health there, I think would be important.
Okay, so backing up to healthcare providers, the reason that I was putting that in there is because one of the things that we saw is with the orders, and not all of this was really from the state health officer. I mean, it was from the federal level more, but still to be considered is how many healthcare providers had to shut down voluntary care, you know, colonoscopies and checkups and that kind of thing to preserve PPE. And that I think had a really significant impact on healthcare providers. And so that's why I insert them specifically. Any other discussion? Sorry, I'm trying to, okay, all in favor, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. Okay, one opposed? You don't get, it's not dialing for dollars or something. Okay. Page, let's see, we're on paragraph 8. Any comments, any insertions? Okay, paragraph, or after
Chairman?
paragraph 8. Oh, Representative Flitner.
Madam Chairman, you had a fourth suggested amendment that.
Oh, yes.
After line 12.
Well, yeah, and so that the fourth one, it deletes the and on line 20, but then really inserts in line, or I'm sorry, on line 12. And then there's a bunch of, and Representative Connolly has some amendments as well. So pretty much after line 18, I think she and I both have some. And Representative Connolly, if let's just so that we understand, you know, so we're not wordsmithing between two sets, and I like yours just as well. I mean, that we can just, let's just say what those are, and so that the healthcare specific ones. So if you look on the paper, I say my number 9, the ability of the state's healthcare infrastructure or referral networks to care for patients during the pandemic. Representative Connolly.
Your language is just fine.
Well, I don't have the health one. So your number 9 is different.
Madam
Right,
Chair.
but so
my-
your number 10.
Yes, my number 10, I think, is the same as your number 9.
Okay.
And so I will absolutely defer to your number 9 and take out my number 10, but I would like to discuss my number 9.
Okay. I am happy for you to discuss your number 9. But let's do my amendment number 4 first, just because it's, you can, obviously it's divisible, just like any painful thing that we do. You see before you amendment 4, and for those of you out there, I have added actually 4 things, like conference committee. So the first is the ability of this healthcare infrastructure or referral networks to care for patients. And the reason I put in, do I have a second for my number 4? Seconded by Connolly. The reason I inserted referral networks was after talking with Mr. McKay yesterday. There were issues also with transfer of patients out of state facilities and the ability to track them. Then I have a number, I've numbered 10 challenges in the supply chains. And this is sort of a glob, but there were a lot of issues, and keeping in mind that we want to be able to also prepare for some sort of future thing. I mean, who knows what it would be? Medical and laboratory supplies, food, retail products, agricultural supplies. That's just kind of my thought. 11, possible challenges in future. Now here I'm really thinking of the future too, not just now. Future possible challenges in future pandemics in the agricultural, financial, or utility sectors. We didn't really have those too much other than in ag. I know there were some challenges with processing, but thinking ahead, that, I mean, there was a little concern for a while that there might be bank runs. People need to take out their dollars so they can go buy toilet paper and whatnot. And then I actually did insert in here 12, the distribution process for federal funds, which I don't think we really addressed elsewhere. So that's a big glob. And keeping in mind that we will add in or address Representative Connolly's other amendment afterwards. So discussion on my big glob amendment. Oh, that was nothing like being chairman. Okay, all in favor of the glob amendment, raise your hand. 1, 2, 3, 4, 5, 6, 7. Oh, Stivar's even voting this time. Okay, 9-0, very good. Okay, Representative Connolly, present yours.
Yeah, thank you, Madam Chair. I'd like to add what I would call the obvious one, which is my number 9, which you were emailed, and I'm going to add in, honestly, Representative Flitner's suggestion, which would now read the impacts of the COVID-19 pandemic on the short-term and long-term physical and mental health of Wyoming residents. And mental. So would you please add that little phrase before what you probably have in writing already? Thank you, Bonnie.
Okay, is there a second? Seconded by Stivar, good job. Okay, discussion.
Then I'm gonna vote no.
Question being called, all in favor, raise your hands. 1, 2, 3, 4, 5. None from the doctor. 6, 7. 8. Oh, it's only the doctor who doesn't want to study the impacts on health. That's very puzzling, Dr. Hallinan. 8-1. Okay. Just razzing everybody. Okay. And Representative and committee, if I might ask, just in working with the secretary, we might decide where thematically to fit this amendment best in my glob. I mean, really, just so you'd like to have sort of a flow. That's all I'm in that. Okay, then we have bottom of page 4 about the goal. Page 5, compensation. Section 2 is the appropriation. I'm not sure that we should bother trying to do the math appropriations. I mean, this is going to have to be re-referred to let them or mess with that. Okay, any further discussion on the bill? Okay, Bonnie, would you call the roll, please?
Representatives Clifford.
Aye.
Connolly.
Aye.
Flitner. Hallinan.
Aye.
Ottman.
Aye.
Martinez.
Aye.
Stivar.
Aye.
Worf.
Aye.
Madam Chairman.
Aye.
Madam Chairman, we have 9 ayes.
Okay, committee, we have not quite 20 minutes left. We can do it. All right, the next bill for our consideration, if I can find my bill, here is, I have too many pieces of paper. Senate File 52. Insurance, mental health, and substance use parity, sponsored by Senate Labor. Guys, this was a committee bill. We drafted this way, and actually, I'm just going to go and present it to, let's see, we had a motion on the bill. Is there a second? Oh, actually, I guess I should present it first. Sorry about that. But, okay, committee, this was an interim bill. To be honest, I drafted it. There I am. It's good to be chairman. And we drafted it, but the committee went along with me. The issue was, and this was, it started off as a COVID specific topic, but it doesn't have to be that way. The situation that we saw at the beginning of COVID, and in fairness to the insurance sector, much of this has been resolved mainly by the big actors. So we're kind of running along and tidying up in statute just to pick up all the little pieces. But as mental health and substance abuse providers especially were closing down or wrestling with the COVID, and we are starting and trying to do telehealth. We had a couple of issues. One issue, of course, was just the broader issue of people, whether they had broadband in their house, whether they had a cell phone. I mean, that's not addressed by this bill. Okay, I mean, that's a separate issue of people's access to technology, whether they had it in their home or not. The specific issue that we're addressing in this bill was that I heard from some providers that when they were helping counsel a patient by, on their laptop or even by telephone, that they were not getting paid the same as they would have if the person had been in their office. So we had a lot of discussion about this. This sort of issue has been a very broad discussion in the telehealth area for some number of years. And there was some discussion, well, it would be great to have all telehealth services be paid, that we would mandate to have them be paid the same. But we just felt the issue of whether a family practitioner can adequately diagnose bronchitis, say, by listening to you over the phone, are we really there as a committee to be able to determine that? But we did feel, and, we'll probably hear some testimony on that by and large, the ability to counsel a person, maybe not perfect. I had a friend of mine who's a counselor say, you can read a lot by their body language and you may be missing that. Fair enough. But we just felt like this was something that, given the vast need for mental health and substance abuse providers to be able to provide services to their clients by telehealth services, what we are doing. And page 2, it brings in the Mental Health Parity and Addiction Equity Act. That was a federal thing from some years back, actually 2008. Yeah, boy, seemed like a really time ago. That's all existing language. That parity, I think that was Representative Dayton Selman actually that brought that in a couple of years ago, but that's existing language. But the new language you'll see starting on page 2, line 15, no policy or contract providing mental health or substance use coverage. So if they don't provide it, this doesn't apply. We're not mandating a new coverage item as far as a service. And that's key because when we found out in the past, about 8 years ago on labor health, that if you mandate new things that are actually not covered, the insurance providers are able to deduct the cost of that from the tax that they pay to the state. We're like, well, we didn't. So that's not what we're doing. So line 19, they may not deny coverage, line 23, for the same service when delivered. So in other words, if the insurer pays for the service in person, they can't deny it if it's paid by, and we have here remote audio or audio visual. I do believe that there's an amendment coming from insurance folks on that. We'll deal with that later. Then on page 3, they may not charge copayment, deductible, and coinsurance that is higher, line 5, higher than. So in other words, you can't charge a person $10 if you see me in person, but $20 if I do it by telephone. And line 9, they may not reduce the payment to the provider to an amount less than what they would be paid if the person were providing it in person. So in other words, if you pay $50 for a half-hour time visit, you can't pay only $30 for them to do it by audiovisual. And that's the entire. I do see, and when we've got insurance folks online, we'll bring them in, and I don't know if the is there anyone from the Insurance Commission on, Bonnie or Donna?
I have 2 people from Blue Cross Blue Shield on, Madam Chair. Shall I admit them?
You can admit them. I'm not quite ready yet, but folks, line 318, the effect, the applicability, April 1 is probably in there from our interim work. The session's not actually going to be over now by April 1. So I'm not sure we might need to amend that, say to, pick a date, July 1 or January 1, 2022 or something like that. Representative Stiver.
On page 3, line 11, we need to put audio in there because you've got audio over here on page 2, line 20.
Very good. When we get ready for amendments, bring that back up again. Okay, any more questions on the bill? Okay, wait, actually, I guess we aren't really ready to move. We're going to unmove the bill. I'm not sure if there's a process for that, but I'm sure I made it. Okay, we need to take public testimony. Who have we got in the room to testify on the bill?
Madam Chair, I've admitted Wendy Curran and Heather Roday of Wyoming
Good.
Blue Cross
Well,
Blue Shield.
we've got one. Go ahead, come on up. We'll swap them back and forth from in person to online. Practice our telehealth. Lindsay Semino.
Madam-
Yes, Donna. Yeah, hold on. We'll hear from Lindsay's at the table here. Go ahead. Introduce
Madam
yourself for the
Chairman,
committee.
members of the committee, my name is Lindsay Semino. I represent the Wyoming Counseling Association. I had the opportunity to work with Representative Wilson on this bill. As she noted, when COVID first started, there was a lot of confusion, a lot of chaos. And what we initially saw as providers was insurance companies denying telehealth services within the first week. Approximately 10 days once shutdown began, so around March 23rd, we saw that change and we saw insurance companies approve telehealth services for mental health temporarily on a 3-month emergency basis. As COVID has gone on, they've extended that every 3 months. So May was the first deadline of 2020, then August, then October. We are starting to see some policies begin to limit that again, as some of us begin to see clients in person. And what we are hoping to do with this bill is to extend that emergency provision permanently in Wyoming. We have a great number of rural clients within the state that can be seen in a greater capacity through telehealth. And what we are seeing is that because of the mental health budgets that have taken place, they're going to need that greater access. We are going to end up having to cut different services in person when it comes to our community health centers because of the recent budget cuts. And so this will help expand access for those clients. My colleague, Andy Somerville, sent you all 2 executive orders this morning once we saw that this bill was up and running from the Trump administration, one signed October 3rd, 2020, and the other one signed August 3rd. Both involve increasing access for mental health for rural areas, as well as improving telehealth access for rural areas. Specifically on the August 3rd, 2020 executive order, Section 5 speaks specifically to expanding flexibilities beyond the public health emergency. This bill aligns perfectly in that it's going to take the flexibilities that we had from the insurance companies for these temporary telehealth services and expand them and make them permanent beyond that public health emergency. What we're also seeing is that though this was started by the Trump administration, the Biden administration is also supporting that expanded access. The reason that it is more essential for mental health providers to have this telehealth piece is 90% of the service that is rendered is originated by the provider. And that is regardless of whether it is on telehealth or whether it is in person. And so we see that the efficacy is the same, regardless of in-person to audiovisual. So we are really hoping that this will address those issues that we saw within those first 2 weeks, as well as expand access overall. And with that, I stand for question.
Questions for Ms. Semino? Kudos for bipartisanship, say both administrations. Okay, thank you, Ms. Semino.
Thank you, Madam Chairman.
Online, we had Wendy Curran and Heather Roday, I believe. I let them in, or they're in probably anyway. Good morning, Ms. Roday. Ms. Curran, how are you?
Good morning. Fine, thank you. Chairman Wilson, members of the committee, I'm Wendy Curran with Blue Cross Blue Shield of Wyoming. We have expressed previously our concern with this bill, not based on the excellent opportunities for increased access that the bill provides in a time when we need it with declining budgets and in our rural areas, but the fact that it is indeed a mandate that sets in cement the requirements for how and what will be paid between 2 parties, the insurer and the provider. We are not among the companies that Ms. Semino may have mentioned who have not paid for it. We have always paid for telehealth. We have supported it for years. We will continue to do so because our first concern is about access to care for our members. We do, however, believe that there is some concern that this mandate will result in additional costs to the state and will not necessarily address the current healthcare costs today. We do have some amendment language that we have offered and would like to discuss. And if you'd like us to talk about that, Madam Chairman, I will ask Heather to do so.
That would be good. Committee, I'm not sure that you have that language, but I have it. At least so
I think
I'm glad to know that. Oh, you have it. Okay, everybody has it then. It says proposed amendment, Senate File 52 on the top, and you can see the insertion of by the same provider. Okay.
Yes. So good morning, Madam Chairman and members of the committee. We just have some clarifying language. We believe that this language, if you're ready for it, is friendly. For the previous paragraphs where we're adding by the same provider at the end of the sentences, the different providers sometimes bill different ways, different specialties. So we were just clarifying that if the provider would be offering that service in person, it would be billed via telehealth the same way. So that's the reasoning behind those additions. And then the larger add would be to add Romanet 4 that basically offers two potential issues. It clarifies that the bill wouldn't restrict agreements between a provider and insurers as they do today. So there are some payment arrangements that are made, and as we move to value-based care, we want to be able to have the flexibility to do that. And then the second part talks about medical management. And what medical management is efforts that insurers use to make sure that the member is getting safe, accurate, and necessary care. So an example of this might be making sure that if a person has been receiving services via audio only, that they check in person at some point in time to make sure that the provider is able to have eyes on the patient. So that's the clarifying language there. And if you have any other questions, I think Wendy and I would stand for those questions in the interest of time.
Okay, questions for Ms. Roday or Ms. Curran? Representative Connolly.
Thank you, Madam Chairman. Ms. Rodan, I'm honestly seeing that rest of the sentences after the or in Romanet 4 as really canceling out or could cancel out the first portion of 4. And so that concerns me.
Ms. Roday.
Representative
Our point, go ahead, Wendy.
Representative Connolly, you were referring to the use of appropriate medical management. Is that by which your question?
Madam
Ms.
Chair,
Connolly.
the language that restrict the health insurer's ability to apply appropriate medical management honestly takes away that kind of negotiation that existed with the first portion of it. That in all honesty, I think you're putting your thumb on the scale saying that the health insurer's view of the appropriate medical relationship will be primary and will always win out. So that concerns me, honestly. So I'd be fine with 4 if we put a period after agreements on that second sentence. But I am concerned about the or.
Ms. Curran, any thoughts?
Madam Chairman, Representative Connolly, that certainly isn't the intent of the language. Medical management is sort of a catch-all phrase for a lot of efforts. I know sometimes those are branded as ways to reduce care or reduce payment. In our case, it is simply saying that we would like to continue to be allowed to set up parameters for the care that simply assure quality. For instance, and I think the example that Ms. Roday gave is perfect. I talked about this earlier. We don't want to see somebody set up their telemedicine practice in the computer in the back of a car. We want to have assurances that there has been some patient professional relationship established, that there has been at some point in time some visual exam. Audio visual and audio only can provide great services. It is not appropriate for some of the clinical issues that we face. We just want to have an ability to say, we'll pay for all of this. We may ask you to show that you had an in-person visit, something like that. We haven't really thought it through, but not having that ability does give us concerns about being able to track and support the quality of the care that might be coming. And it isn't intended to be other than that.
More questions for Ms. Curran or Ms. Roday? Representative Stiver, are you? No? Ms. Semino, do you, I want to just give, and we don't normally have, well, we actually do often have back and forth among our witnesses. Just from the practice side, I assume that you see medical management in your in-person practice as well. How do you see this working?
We do see from time to time that the insurance provider will require the provider to take necessary steps, whether that's through documentation or through a routine pre-authorization. And so we have seen that. However, during COVID, we've been forced to do initial intakes and build those relationships initially all through telehealth. We were not able to do those initial in-person visits. We've also seen that care stays consistent and that care is does not drop or is lessened because we're not able to initiate that therapeutic relationship in person. We are able to do it via telehealth, and there are certifications to ensure that we as providers are able to do it via telehealth. Yes, did that answer?
Yeah. Questions for Ms. Semino, Representative Connolly.
Thank you, Madam Chair. Ms. Semino, is my concern about the language after the word or, have you seen this amendment?
I stole it from our beautiful secretary.
Thank you. Is my concern about the language after the or legitimate, or am I just, I'm reading too much into it?
I don't.
Perspective.
I do
Ms.
not.
Semino.
Oh, Representative Connolly, Madam Chairman, forgive me, I am watching the clock. I do not think it's unreasonable at all. What we have seen with insurance providers, maybe not specifically Blue Cross Blue Shield, but other payers, is that if there is flexibility, that they will use it, I think is the best wording for that. So I do not think that your concern is unwarranted.
Okay, so you agree with Representative Connolly's concern about the wording?
Correct.
Just to be clear. Representative Stiver.
Madam Chairman, Ms. Semino, does Medicaid require, if it's a Medicaid patient, or Medicare patient, that's having these services, are they required, or is
An in-person, Representative Stiver? Representative Stiver, Madam Chairman, I do not believe so. I would also refer to my colleague Andy Somerville to see how the community mental health. I have experienced though through my own Medicaid billing that they have not required that CMS has not put that requirement on the providers.
Okay, good. Any more questions? All right. Thank you very much, Wendy and Heather.
Thank you.
Donna, is anybody else online?
Yeah, Madam Chair, I have 5 additional people in the waiting room wishing to testify. Would you like me to start admitting people?
Let me just say this. Okay, those of you 5 in the waiting room, consider very carefully whether your testimony is really vital, because if we have to hear all 5 of you, I will postpone the bill, the consideration of the bill until Monday. Because we don't have, it's not been posted for this afternoon, and we'll have to go on, and it may very well prevent us from completing our work. Yes, Representative Wharf.
If it's not out of committee today, it
Was
can't
today
go.
the last day?
Today's the last day. It's my understanding.
Madam Chairman, it's a Senate file bill, so it can be.
Yeah, it's so that is a Senate file bill, but nonetheless, we have other Senate files coming on. This is a really important bill, but so having said that, who on the, and I'll give you 2 minutes each.
Okay. I
Donna,
now
let
have,
everybody talk in 2 minutes.
all right, I now have 3 people with their hand up. Shall I admit all 3?
Sure. They've sensibly reduced themselves.
I'm admitting Dr. Hollis,
I don't have my timer. Representative Connolly, can you?
Dr. Hollis Hackman,
Yep.
and I'm admitting Andy Somerville,
Okay.
and I'm admitting Thomas Laycock.
Okay. There are 3 people. 2 minutes each. Andy Somerville, you're there first. So you got 2 minutes. Start talking.
Thank you, Madam Chairman. Andy Somerville, Executive Director of WAMSAC. My comments are very brief. We definitely support the bill for all the reasons that Ms. Simoneau described. I would add that our no-show rate on telehealth for our community mental health centers has dropped 25 to 30%, which is outstanding. It is a really critical tool in the toolbox for the future to provide rural access care for community mental health centers. And then just real briefly, I would ask the committee to not approve the amendment presented by our partners at Blue Cross Blue Shield right now. And I simply ask that because we have not seen the language to it. And we do have concerns as expressed by Representative Conley based on what I've heard on the meeting this morning. So I would ask that we be given a little bit more time to review that and provide comments back to you when it goes to the floor. And with that, I would stand for any questions.
Questions for Ms. Somerville? Thank you. Representative Stivar has reminded me that Senator Lummis is coming in today at some undetermined time. Dr. Hackman, welcome. 2 minutes.
Good morning, Madam Chairman, members of the committee. Hollis Hackman with the Wyoming Psychological Association. I would just point out, notwithstanding the insurance business's concern, but Wyoming is one of 8 states that does not have anything on the books that help regulate telehealth and require insurance companies to cover telehealth and audio. And so it's not like this is something unusual. In fact, the 42 other states already have something in place. And I would just also emphasize that there are at least 13 studies that show that audio only is as effective as in person. And there's a multitude of other studies that identify the same with telehealth interventions. And so I just wanted to make those two quick points, and I would stand for any questions. Thank you.
Great. Questions for Dr. Hackman? No. Okay, super. Thank you. Tom Laycock, welcome.
Thank you, Madam Chairman, committee. Tom Laycock, the Associate State Director for AARP Wyoming. I wanted to just bring up a couple quick little points. So we're very supportive of the bill. One of the questions that we tend to get from time to time is are our members actually what's their uptake rate in terms of telehealth? I'll tell you that after the originating site restrictions were lifted in mid-March, nationwide over 10 million telehealth services were delivered nationally each week. Before that, it was just 14,000 Medicare beneficiaries receiving services each week. We also did ask, we did a survey this last year. The 2020 Vital Voices survey reported 78% of Wyomingites age 45 or older surveyed said they would love to be a part of telehealth. Now, the other 22% said they had no interest in it whatsoever because in a lot of cases, they might not have strong internet or just not the interest of learning that, and that's fine. So we want to make sure the telephone is also an option in this bill. So with that said, I'll be quiet and let you move on.
Questions for Mr. Laycock? Okay, public testimony is closed. We moved and seconded the bill already. So is there any discussion on the bill?
Yeah, Madam Chairman.
Representative Stivar.
On page 2, line 20, it says audio or visual. On page 3, line 11, we need to insert audio there too.
Okay, so I would say page 3, line 10, after the words remote, insert audio or?
Yeah.
Okay, is there a second? Seconded by Romero Martinez. All in favor? Any discussion? All in favor, raise your hand. Everybody? Okay, 9-0. Any other amendments? We do have the one of the proposal. We can either work that in today or we can maybe consider it for floor consideration. Any further amendment? Representative Stivar.
On section 2, extend thereafter April 1st, 2021. Put December 1st, 2021.
Okay. Any, is there a second? Seconded by Ottman. Any discussion? Representative Connolly.
Madam Chairman, I would like this to go into effect as soon as possible. April 1st doesn't make sense because that would bring it backwards probably, but I would use that basic language that it goes into effect as soon as any of the terms of this act is effective immediately upon completion of all acts necessary for a bill to become law as provided by Article 4, Section 8 of the Wyoming Constitution.
the issue of this though is its applicability to policies when the policies are issued. So, I mean, I think as an insurance company is developing a
Got it.
policy, it probably needs a date of the policy.
Got it.
So I'm just thinking, the reason, when we wrote this, like last year, we had put it out because I think insurers develop their, they do have actuaries and all that kind of thing. So, I mean, I understand what you're saying, but I think that was the thing. Representative Stiver? Yeah, I think so. Seems good to me. I mean, we'll hear otherwise, I'm sure, if someone wants a tweak on the floor. Let's go with that. All in favor, say aye or raise your hand. December 1st, 2021. 1, 2, 3, 4, 5. Okay, everybody, I assume. All right. Any other amendments at this time? Nope. Bonnie, take the vote, please.
Representatives Clifford. Connolly. Flitner. Hallinan.
Aye.
Ottman.
Aye.
Martinez.
Aye.
Stivar.
Aye.
Wharf.
No.
Madam Chairman.
Aye.
Madam Chairman, we have 7 ayes, 2 noes, the noes being Representatives Flitner and Moore.
Okay, so committee will go with that. If we need to bring some more floor amendments, I think it's not, we can manage that. Zip upstairs and try to be ready for Senator Lummis if she's actually there. Okay, Bonnie, I'll get with you here and meeting's adjourned.